Dr. Vaibhav Arshe sir to share his experience regarding liver transplant in AIIMS Jodhpur.
Good afternoon, chairpersons and all the delegates. So first of all, I would like to thank Professor Kuldeep sir for involvement in this workshop on rare disease. So as Professor Charan already mentioned that there are certain diseases, certain rare diseases which have been included in the group 1 for which we can do liver transplant. And AIIMS Jodhpur has started liver transplant for last 2 years. So sir has involved that so that we can do the transplant in these certain disorders. So although we have not done any liver transplant till now, but we are determined to do that in near future. So I will be talking about our experience, the last experience from where we have started and reached till now, and what is our plan in near future. So just for the liver transplant can be done in various ways. One is living related liver transplant. So what we did in this case, the donor of the individual donates the portion of his liver, around 60%, to the patient, in which first we retrieve that diseased liver and then put the either the right lobe or the left lobe into the patient. The other modality is deceased donor liver transplant, in which the whole liver from a brain dead patient is retrieved and implanted into the patient who is suffering from a chronic liver disease. Now, the other scenario is liver transplantation. What we did in this, suppose if a pediatric patient needs a liver, so we split this normal liver, which we have removed from a deceased donor, into say segment 2, 3, that is, the cursor is working. This is segment 2 and 3. So this portion will go into the pediatric patient, and this portion of liver will go in adult patient. So by this, two patients who are suffering from liver disease will get benefited. So this is split liver transplantation. So this is useful in certain scenarios of pediatric age group. Now the other one is dominoes liver transplantation. What is that? As we play dominoes, in which one stick hit to the other stick to the third one. So same thing happen in domino liver transplantation. So we take liver from one patient, which is diseased donor, and then it goes to a patients who have a metabolic liver disease, and from that particular patient whose otherwise liver parenchyma is okay, only the 1 or 2 liver enzymes are deficient, that particular liver will go into a patient who is say 50, 60 years old liver disease, into that patient, and for that patient, it has seen that that particular metabolic disorders do not come, or it comes very late, 8 to 9 years. By the time patient has lived their normal life. So it is a domino liver transplantation. 3 patients are required. One is diseased donor, who gives a liver to the patient who having metabolic liver disease, and the metabolic liver disease patient's liver will go into a patient who have a cirrhotic liver disease. So this is domino liver transplantation. This is primarily done in cases of FAP, that is familial amyloidosis polyneuropathy cases. Now, initially, we started this journey in July 2020 when we applied for the license for this liver transplantation at AIIMS Jodhpur. This was COVID times. The inspection was done at a 1 year time. The team came from Jaipur after a span of 1 year. And then we received the license and after next year in February 2022. Then our plan was to build up a team, build up all the logistic supports, all the equipment which are required to perform a living donor liver transplant. Then we collaborate with ILBS in New Delhi, Institute of Liver and Biliary Sciences, and around 14 or 21 members of the liver transplant team went there, ILBS, and in a month we observed them, how they are doing, what are the intricacy, what are the things we need at our center. We observed, and then we came back from September 2022. We started doing all the corrections, and then we select the first patient. Then when we are planning, so we should select patients who having a low MELD score, a good performance status, so that we could have optimal results. We arrange all the logistic supports from the administration, everybody planned, and then we called our ILBS team, and this first living donor liver transplant performed on 10th February 2023, and we could discharge that patient after 24 days. This is the team we did the first transplant. In the center, you can see Dr. Professor Manoj Kamal and Dr. Professor Pamecha, along with other team members, who was a leading role in that transplantation. So that was a landmark in the history of Rajasthan, because that was the first living liver transplant that happened in the whole state of Rajasthan till now. So that gives a boost to everyone that yes, everything was done successfully, everybody was happy. But as you know, that things are not so easy. In the history, when the transplant program was started at any center in the world or in worldwide or in India, there are hiccups. So same thing happened with us. Our next two patients had very severe infections, and they could not survive. So we were back to square one. We again sit back. Discussion was happened with that, and in the what went wrong. So in operation theater, in our ICU, we nursing officer orientation program happened. We instituted the new antibiotic policy, how to manage those cases, and we incorporated the wider team, including the infectious disease department, which handed our hand that if there is an infection, we will take care of that. So don't worry and do the transplant again. So again, we did a transplant after a span of 4 months, our 4th liver transplant, and we successfully discharged our next 4 living liver transplant successfully. So that is the patient who was our 5th patient, which we discharged after a span of 58 days. But he is doing well and still in a very good shape. Now, after this living related, the question came, why not disease liver donation? As I mentioned, from a brain dead patient. Because that is the thing, because our government also emphasizing on that that organ donation is the foremost, because when we are taking a liver on normal, that person is not even a patient. That is a normal person who is donating his liver. So if we can retrieve a liver from a diseased donor who is brain dead, so that is the one thing which is, we are not harming anyone, that person is not at risk, he is already brain dead. So this is the thing government is also pushing. So we also, our administration told us that we should go for it and we should promote this thing, because this is the future. So a brain death committee was formed, and we organized a sensitization program and a workshop on organ donation in collaboration with NOTO. So you can see the director of NOTO, Dr. Anil Kumar, is taking the talk, and at that time, the director of SOTO, Dr. Amarjit Mehta, was sitting there, along with all the team members from the urology department, nephrology, and our team was sensitized. And you will be happy to know that after 1 month of this sensitization program, we could perform our first disease donor liver transplant at AIIMS Jodhpur on 20th March 2024. So in this case, the organ was retrieved at AIIMS Jodhpur and implanted in a patient from AIIMS Jodhpur. So this was another landmark in the history of Jodhpur, that we could perform our first disease donor liver transplantation. But we called again our team from ILBS, who supported us in performing that liver transplant. At that time, our current director, Sir Dr. G.D. Puri, joined in February. So he asked me that, why can't you do it on your own? What is the problem? Tell me. If you are not trained, go for training. If you have no knowledge support, I will give you, but do it on your own. So that was the adrenaline pump, that I am with you, go for it. So on 16th August 2024, we performed our first independent DDLT at AIIMS Jodhpur, and even neitherly AIIMS has not performed it till now. They are still taking support of external team, but we could perform it. And we retrieved the liver from Jaipur, and we implanted in our case at AIIMS Jodhpur. And for this, the secretary from MSSY also came to congratulate us, and the joint director is also there. They came and visit our liver transplant ICU and the patient for that. So after that, we also performed our first simultaneous liver kidney transplant, that is SLKT. So it was an autoimmune patient suffering from CLD as well as CKD. The organ was retrieved from the Jhalawar Medical College, Rajasthan, and our institution supported us from airlifting. That was the first time in Rajasthan that an organ was airlifted from Jhalawar Medical College to AIIMS Jodhpur in our sports ground. Everybody knows about that. And now we have done around 16 liver transplant. Primarily started with living related. Now we are in the last December, we have performed 3 disease donor and 1 living related liver transplant. So this is a timeline. Basically, our journey started in February 2022 when we got the license. Training was done. So performed first living related liver transplant in February 2023. Then first DDLT in March 2024. First independent in August 2024. And then first SLKT in December 2024. So these are the various cases for which we performed the liver transplant. If you see what are the common indications, so one is acute liver failure, that acute viral hepatitis, autoimmune hepatitis, some drug-induced hepatitis. We are primarily now doing for CLD, chronic liver disease. In this viral hepatitis, we have done for 1 cases, predominantly cases of alcoholic liver disease, metabolic dysfunction, that is NASH-led CLD, which is very common nowadays. That is non-alcoholic steatohepatitis causing the liver disorders, and then autoimmune hepatitis, and one worst case was primary sclerosing cholangitis. The other indications are for malignancies like hepatocellular carcinoma, intrahepatic cholangiocarcinoma, hepatoblastoma, and cryptogenic. Now coming to this theme of this CME, that is rare disorders. So what all disorders in which we can do liver transplant, we can offer liver transplantations. So primarily are metabolic liver disorders, including glycogen storage disease, thalassemia, maple syrup urine disease, urea cycle disorders, and organic acidemia. These first 5 disorders have been listed in National Policy of Rare Disease as NPRD, for which, as Professor told, that we can get the funds for if we are operating on these scenarios. Otherwise, we have other disorders also in which liver transplant is required, like polycystic liver diseases, including progressive familial intrahepatic cholestasis, that is PFIC, biliary atresia, hepatic fibrosis, venocyst intellectual disability syndrome, polycystic liver disease, and the others are miscellaneous disorders. As I mentioned, the familial amyloid polyneuropathy. For this disorder, primarily Domino's liver transplant has been done in the past. And the last indication is methylmalonic aciduria. In this, basically, simultaneous liver kidney transplant is usually done, and that is also included in NPRD. At the end of my presentation, I would like to just acknowledge all the team members, because this liver transplant is not a one-man job, it's a teamwork. It's a team that involves like more than 50 persons. So all the deceased donor family who's consented to donate the organ of their near dears, all the living donors who believe in our team that they donated their organ, the transplant coordinators who work hard to counsel those family members to donate the organs, our operating room and ICU staff who work 24/7, Department of Anesthesia and Critical Care for maintaining the patient intraoperatively as well as postoperatively, Department of Diagnostic Intervention Radiology. If whenever we need them, they come and do the ultrasound, and whenever we need an IR team, they come. Department of Transfusion Medicine, Department of Gastroenterology, Department of Microbiology, Infectious Disease Department, Department of Cardiology, Pulmonary Medicine, Department of ENT, Dental, Psychiatry, Department of Nephrology and Urology, and last but not the least, the admission of our AIIMS Jodhpur, because they support us that whatever you need, we'll provide you, just go ahead. Thank you so much for the patient listening. Any queries you can ask.